don't show say, I mean, people, they die as a result of those mindsets we people and they get from that of taking antibiotic, where it prevents, for get pregnant, or we terminate pregnancy. And also the drip way people in the take, we also faster than whatever means of treatment again, where they get in terms of medicine or that of injection. Drip is more faster. So people, instead of medical prescription, people fastly or quickly enough, they make request for those things because of they feel within themselves that it can make them well faster. So this is a growing concern. I mean, the death rates don't be alarming. As I said, the one day we go through all this, we feel like this is a solution to their health problem within the age of 15 to 24, according to Dr. Ibrahim Kamara. I tell you that not only consume this, not only take then step there, self-precaution, for see that then well without a medical prescription. So that's what we're about to discuss in the program this morning. And for me, we discuss how serious this be and waiting need for be done. So the expect to get Dr. Augustine A.D. Tarawally, we not medical superintendent, Sierra Leone, China Friendship Hospital, Jue. So they be part of the program, and for which we can discuss, I mean, waiting, what kind of antibiotic people can take for them kind of thing there, how misleading or how then they misuse this, and waiting and need for be done. And I'm joined in the studio by Dr. Augustine A.D. Tarawally. Doc, good morning and welcome to the Epic Morning Show.
Good morning. How you doing?
Actually, it's right for me fine like you, but not completely fine like you. I mean, so how the job so far?
Well, it's good. It's challenging, but we keep moving on.
Okay. So, which are the challenging parts of the job?
A lot. One is patients that show up in hospitals very late.
Okay.
They're going to begin sick, then delay for visit the hospitals. And some of them, when they're sick, they look out for other alternative means of treatment. For example, they can go to traditional healers. They can decide for self-treat themselves, go to a pharmacy, buy any medications. Until they don't exhaust all the resources now, they show up in a hospital. So you, the doctor, you, the medic in that facility, especially in government hospitals, you get a duty for help them, right? But then still get a duty for provide within you need for them, especially when it comes to medications, and especially the one the way they within the free healthcare category.
Yeah.
So in such situations, they can go deal with nothing. So except with the healthcare workers, that we come together, doctors, nurses, and others, we come together for helping patients in the other challenge here is most patients they can show up, or they can bring the kind of hospital subconscious as a result of a whole lot of things like road traffic accident, complicated malaria, and other things. Right? In such cases, in such emergency situations, they left with the hospital and the staff for take care of them people within the. Because imagine accidents happen.
And which of course we are constrained with for dealing with emergency as well.
Definitely, we are extremely constrained with emergencies. If I not say, quite recently I read a publication wherein from Connaught, most of the death they happen as a result of road traffic accidents. From bikes, kekes, and other movable machines on the road, and even pedestrians. And what make the situation become more complicated is the fact that we young people don't indulge in the use and abuse of substances. So some man they take what you're not supposed to take. You go ride bike, you go ride keke, while they in that ecstatic mood or whatever, the hallucinative mood, it behave recklessly. Yeah, where they lead to death and accident.
Okay, so no, to the topic of discussion that is challenging for you. Well, and Adande will not sign for. So definitely. So make we talk to we talk about the topic where you look at the misuse of antibiotic and that of drip, to put it right, the mindsets of Leone. I mean, I think at some point usai salon man get that mentality, the usai that mindsets they come out. We feel like okay, in a first place, if I take antibiotic, I mean, I get a write up from Dr. Ibrahim Kamara. We talk about mostly woman, the female gender. I mean, it will prevent pregnancy, or if you get belly, it will terminate pregnancy. I mean, from the medical side, I mean, don't talk about antibiotic. When are the use of antibiotic?
Antibiotics, this now a group of medicines that would be used for treat sickness that they caused by bacteria.
Okay.
Right? And bacteria, these are microorganisms. We some them good, some them bad. Some, if they're in the right environment, then good. But when they move them from the right environment, then bad. They cause diseases.
Okay.
And them microorganisms, they're all over we. Right? In fact, now they get this world, this earth belongs to microorganisms. All other organisms are just strangers. We just pass through. And we use them even in food, right? For make beverages, we get medicine are used for it, then get industrial use for it, then get military use for it, where they use them as weapons of war, etc., etc. Right? So antibiotics, they for treat mainly diseases which they cause by these bacteria.
Yeah.
But as Paracelsus, one ancient pharmacologist, may say, all substances who they use na poison. Even water we they drink na poison. What made the difference between the poison and the medicine? Now the dose.
Okay.
The quantity we they take. The time we they take and the duration. Now they make the difference. So, with the example with whatever I just said, if you drink 1 cup water now, they'll see that's more to take rubber water, you'll be fine. But that same water, we didn't say that to take, attempt to drink 1 drum, right? It will harm you. So, likewise, na so medicine dey. So the same substance, different quantity, get different effect. Not so? In Sierra Leone, as most parts of the world, people they don't use for misuse antibiotics. In some other countries, they try for control them. They don't do well for control them actually, even though you know 100% yet. In Saloon, we say they try, but we challenge a lot.
All right. The mindset, like I talk about, how waiting people and they take them antibiotics there, not probably represent the real function. And I talk about one for prevent pregnancy, for terminate pregnancy, and of course the other one there, well, it common within boy picking. They will tell you that. I mean, STD, I mean, sexual transmitted disease, use antibiotic as well. So, I mean, let's look at the real use, waiting you can use them for. I mean, whose kind of sickness you feel like, okay, if you get cold, you can take antibiotic. If you get XYZ, you can take antibiotic. I mean, let's have the real conversation, like waiting with the use them for. So, people out there will look and say, okay, if I get cold, I'm supposed to take this antibiotic. If I get so I suppose to take this. If I get many sexual transmitted whatever, I suppose to take this. So let's have that conversation, doc.
Okay, for starters, as a doctor, I know consider and say, where you get this, take this medication.
Okay.
There are millions of people listening, and it's very wrong for me to do that one day.
So you advise only then go hospital first.
Yes. Best advice will be, when you sick, go hospital. A doctor will see you, or a medic will see you. It will establish the cause of your sickness. Then it will prescribe the appropriate medication. Yeah. But for see, when you get cold, in fact,
I just
an example.
Yes, yes, I just give example.
But I consider and say when you get cold, take antibiotic. You can say common cold is not caused by any bacteria. Like a different organism they cause a virus they cause common cold. And then then you set of medications who they give. They call it antivirals.
Okay.
Right? So best advice, when you sick, you make it not begin feel abnormal from your normal physiological with IBD before. See a doctor. Go hospital, then go see you and attend to you. Once they don't pinpoint within the cause of a problem, they go prescribe the appropriate medication, the quantity way for use, the duration way for use and for.
So you want for condemn, say, well, the antibiotic, ampiclox, moxilin, you name it. I mean, we like ampiclox, so you find out, say, mainly umango use them for say, okay, after sex, let's take ampiclox. I mean, some look and say, okay, if I pass 2-3 months, I don't see me monthly, make I use them. I mean, let's start off with that one day. Is it not a proper use of ampiclox? Let's start off with it.
Wrong. It's absolutely wrong. And people are being misinformed and they abuse the use of antibiotics. So, as I say, if you detect anything abnormal with you, go first see a doctor. This misuse of antibiotics don't cause a whole lot of problems, even for the healthcare professionals. Number one, people don't need to take the right antibiotic for the right pathogen. They need to take the right quantity with the for take, the right dosage, the right method of how they for take. So this one creates a whole lot of issues. One of the major problems now we will face is antimicrobial resistance. Yeah? The bacteria they don't become resistant to so many antibiotics.
So
simply because of misuse.
We go reach to that day when medicine don't, I mean, immune system. We know say if you take any other medicine again, it need to be effective because it already used to your system. But one thing we like close to this state instance for ampiclox. I mean, with not the use of ampiclox.
Ampiclox, now a combined antibiotic, we get ampicillin and cloxacillin.
Okay.
Right? We can use that as a broad spectrum antibiotic. Right? Meaning it acts both on gram positive and gram negative bacteria.
Okay.
You get an effect on them.
So right? break them down for we small people understand.
Okay. So antibiotics, if we classify based on the spectrum of activity, we get broad spectrum, we get narrow spectrum. Broad spectrum, we can do antimicrobial staining, right? They call it the gram stain. If you watch it under microscope, you see the gram stain on certain bacteria is retained on the slide. So we say then gram positive. The other one, the way it was then, the stain they come out. So they say they are gram negative. So we get certain type of antibiotics, we effective on both then gram negative and gram positive bacteria. So we refer to them as broad spectrum. Narrow spectrum, then they act on only one set of bacteria. Either they act on gram positive bacteria or gram negative bacteria. So we refer to them as narrow spectrum. Yeah. So, but before you use any antibiotic, the medical professional for establish first what is the cause of your sickness. Any disease gets a cause. All disease get a causative organism, especially infections, right? So
So what do with infection now? Ampiclox or any antibiotic not will cure infection.
Well, it cure infections.
So like
right?
that
but that one has to be established. What is the cause of infection first?
So that's we know see we therefore go through medical or doctor advice or prescription. We establish that fact now say we therefore go through doctor prescription, which of course we all accept. But let's have that conversation that Sierra Leonean out there we will understand say in as much as I therefore go through medical or doctor prescription, but this and this is what are not for do, are not for taking in there. So if we are having that we'll open up, like say, okay, I mean one, where woman gets belly, ampiclox or whatever antibiotic not good for take. Look, we can clear. I mean, this antibiotic, it's good for infection and wherever. So people go no say this is good. But at the end of the day, we therefore talk to people there. You therefore go back to the hospital and seek for doctor prescription. Well, it's about raising the awareness and make people understand. I know they have to talk about people and for go hospital, for go seek medical, everything. But let's talk how damaging this to me because people don't use them there for the wrong reason. I mean, 3 1 on state, so it's something very common. I mean, some man says and say very infection. Now these tablets you go take for say ampicillin or whatever, you go take them for say make me. I mean, and besides you know seek medical attention. So we therefore kind of talk about the keep as well. So let's open up that side for say this and this is wrong. This medicine medically is supposed to be for cold, but you can go to the hospital and seek for medical advice because there's different types of cold. And XY medicine is good for infection, but go to the doctor and seek medical advice. So let's have that discussion, and so that people out there can understand, doctor.
Yeah, as we see, as a professional, I got to be very careful about which guy they talk.
That's understand.
That is one.
And one for establish.
I don't want people to misunderstand and continue doing the wrong things. We must say they are against.
Okay.
So, for me to sit here and say, ampiclox is super good for all infections.
No, I'm not saying super good, but waiting it for like medically, like people will say.
Medical, as I say, is an antibiotic.
Like for people with their pressure, is it amlodipine? They will tell you that okay, it's for pressure patients, but you therefore go seek medical attention and know whether you take amlodipine or whatever pressure medicine. So I'm not saying that if you advise people for take them, but they will know waiting a use of the tablets there, and so people don't go use them wrongly. So now you make a beginning states and clearly. So what about ampiclox? People they use for terminate pregnancy, amoxicillin. People would look at say cold or infection. So if they are not being used in that particular side, waiting them day for, waiting at the new work.
So that is what that now I don't see the talk. Now I see antibiotics. They are there to treat diseases caused by bacteria.
Okay.
Any sickness when a bacteria they cause them, would they use antibiotics for treat.
Okay.
But when you sick, right? First see a doctor. Doctor will prescribe for you the appropriate medication, taking into consideration so many other factors we you don't know. We the patient might not be aware of. So when doctor don't see you, they don't assess you, they go thinking and say what is the best fit for this patient. Also don't forget say all medicine gets side effect. So like when you talk about pregnancy and the use of ampiclox, right? All motor might not be the same 100%. So in some people, if you're pregnant, especially during the early stages of pregnancy, you use certain medications, it can lead to pregnancy termination. Spontaneous abortions can happen.
Okay.
Yeah? But we can't talk as I say, when you take this will happen. No. It should be unprofessional and unethical. Yeah? So many people they listen to this program. I know one come here, the SLMDC called me say bring a license.
So it's prohibited for me to talk about waiting at the medicine there, the function and waiting everything they do at the body. You know, right? So as a doctor, for say for enlightening the public, for the people to understand.
This not a pharmacology lecture I can't give now. So I focus on top of pharmacokinetics and pharmacodynamics.
Okay.
This is a public discussion, and most of the listeners they know nothing about pharmacology. Right? So We'll be very careful to tell this.
Okay.
Yeah.
Let's talk about drip. It's another concern way, I mean, in this writes up way Dr. Ibrahim Kamara do. It's about the mindsets of salon people. And they would tell you that drip is more faster than that of injection or that of medicine. Can you you can confirm that for me?
Okay. Who is a drip? Is a broad word. Yeah. We get various forms of medicine, and we get various routes how we administer medications. Right. One of the ways that we medicine can get inside person body now through the vein. They call it intravenous administration.
Okay.
If you take them through the mouth, it's oral, right? If not through the muscle, intramuscular, where they choke you, now you whatever. If not, you just rub them by your body, topical use, it's topical use, right? You can put them below your tongue, sublingual, right?
So the vein is easily for make somebody well quickly.
No.
According to salon people then.
Well done at them thinking, I know who for that totally. Yeah. In fact, all doctors worldwide will advise you say the best way for take medicine, the easiest way, we get lesser harm, right? Now we take the tablet orally.
Okay.
Yeah. It's only under special circumstances where the doctor will see you, he assess you, and decide say this will get intravenous medications. That is in circumstances where you need to take medicine through your mouth. Or if you take them, you throw it out, and they want me well.
So, except in extreme cases, like if you're able to take medicine or drink medicine, that can lead to weight dripping cancer. That's what you're saying.
That is one, but it all depends on the medical judgment of the professional will attend to you. Because you could assess you first, you don't see well for A, B, and C reason, look at this medicine through in vein, or look at this medicine through in muscle. Or look at this medicine through in mouth, through in nose, Lord drop an eye, or Lord pass on the anus, Lord pass on through the vagina. So it depends on the specific situation where the professional is see at that point in time.
As a doctor, would I not find this very challenging? I mean, how people they misuse medicine, or probably how people look at how then we actually become fastly healed, or we how they medically healed. You know, not find this very challenging that the rate and death of our salon people in the die don't become alarming. I don't find this very challenging.
It's a national emergency. In fact, it's not only a national public health crisis, it did gradually transform into national security crisis. Yeah? And if we not stand up as a country for face the challenge head on, over the next 5 to 10 years, we'll become a lost country.
And of course, it's a kill people in fastly that how people they misuse drugs.
Of course.
So as a medical somebody, how like I know you only frequently they say this to me that for seek medical attention, seek medical advice. I mean, but that has been challenging for us as Leoneans. And people look at say and get medicine the way they sell in the street. So is it what you do? So it's one of the way them not for come explain whether the use of medicine on public they make people and for force for make them go to hospital. Is it one of the military they use now?
No, not to because of I've refused for say we get cold take this medicine, we body want take this medicine already they make people they buy medicine on the street. I know people.
But this is a way that you want for prevent by you not stocking, waiting at the use of the medicine that you.
That's one of the ways because I try to minimize the indiscriminate use of medications outside prescription. Yeah. Then I want. But one of the factors we may not look at in Sierra Leone why people they not degree go hospital, right? Especially public hospitals, there is huge mistrust between the public and healthcare system. People they go hospital because of long waiting time, person they become impatient, say I don't can't today from this morning, doctor don't see me it. Or this person just come, they don't think I don't put her inside. They don't left me out. So you don't develop mistrust. See, there is some games at play. What people they fail for realize here is this. In medical practice, would they save or would they attend to the person we most critically sick? Yeah? Now we will get triaging. I mean, where you go, they sort you out first. So that if you don't come, like just come a headache you get, but you're able to talk, you're able to move around, you're able to drink water, you're able to do basic things there without help, then they bring somebody we unconscious on stretcher. I would definitely say, may you go with force, Lord attend to that person within coma. So now this can make people they can go to the hospital. We doctor they attend them quick, we immediately become frustrated. That's just one factor. The other factor here is this. People will say, you just not go to the hospital, they say, I pay money for my doctor see me, or may I buy chat, may I do this for my doctor see me. Why not just buy this Panadol on the street for this my headache? You understand? It's much easier for them and simpler because they want things to be done very fast. Yeah? But with healthcare system for now, apart from the one the way government we don't protect under the free healthcare, anybody who seek healthcare services at any institution, be it public or private, you have to pay for those services at the point of use. Some people they find challenging because sometimes by the time you sick now, when you don't get money for go hospital. So, as far as we know, government is working on creating social healthcare scheme, right? Just to get the National Social Security Scheme, there is a process, there is something ongoing as of now for create that kind of system. You no need for wait till you sick before you go hospital and pay for your medications or whatever. Government they create a system wherein every month you pay to that scheme, so that when you're sick, you go to the hospital, you get your services free of cost.
So I know say this health institution or something the Ministry of Health push to it. So whether it don't start or not, it's something I know even confirm it the health institution. But we don't discuss. I mean, there is norm of Sierra Leoneans. I mean, and we don't talk about that into instead of then get medical prescription or go through medical attention, whatever, then no mind for get the only paper doctor or whatever, and then different corner there. One, you don't talk about lack of patience or probably trust. And another one you mentioned, you said about how expensive in particular we didn't call it them be. But how dangerous is this? I mean, for you, not for seek medical attention or prescription, and then you go and go see. But mind you again, the same people who are afraid for going to hospital, now then same hospital or nurse or doctors there, they go treat them people they are back home back. So how dangerous is this?
As I say, a professional we know what they do things rightly. Yeah. People they want quick solutions to their problems. Yeah. So who said they get that temporary relief within a very short period of time, they can go there. Even though in most of them situations they now wrong they do and can harmful to them. Yeah. For who to, as we say, paper doctor, you
want for time that's paper doctor we so themselves na nurse there or doctor like una say people we don't do I don't do on one or two situation why nurse go treat somebody and was again wrong medicine and the person you know for God if we end up lost in life. These are things that frequently they happen, but you see salon people and still continue, they choose not for hospital but to go get self treatments that they also whatsoever.
This is what I'm saying. That self treatment you get because of easy for men to get access to that.
Okay, so easy to
access.
Access.
Yeah, for me then go access to the person or make the person go meet them at the house. Easy, you know, and the time we did spend on them.
How would we fix this? I mean, we go hospital, you get quick attention, because like I talk when I do with patients them according to our sickness, and as a nation, how would we fix this, that we go to hospital will be easily access to any doctor or to any hospital?
Comparatively, if you compare salon access to a doctor in a public hospital to other countries like UK, US, we easily get access to doctor in a salon. Yeah, now forget access to a doctor in US or UK, because then there is a clear pathway. We go through all them pathways in the clear levels of management. So you know the common level.
The reason why I would disagree with you, the reason why I would disagree with you, say Leone, we get our emergency response is very weak, unlike the UK.
No,
which of course it's very just so you agree with me.
No, wait, let me come. I'm coming. The fire pathway in those places, they get various levels of medical management where they go through first. In the common level 1, you go level 3 straight. In Sierra Leone, you go there, you walk straight into Connaught Hospital. Doctor see you. Right? You need to go through you area peripheral health unit first, maybe nurse or the CHO see you. Then I go see like this, I'm not able go na Kiyama Road. When you go Kiyama Road, person go there, see you. If he sees yes, he will manage the situation, fine. If he will manage the situation, you say no, go Connaught. It will refer you to Connaught. Yeah, you can leave this studio now. You go see doctor na Connaught. When we last level of referral, government referral in this country. Notice it's happening. So access to doctors in this country is much easier than access to doctors in UK or US. Yeah. 2, yes, you talk about emergency response. Okay, few years ago, nobody get national emergency medical services. Names nobody exist. Yeah. And considering we country in challenges as compared to UK and other places, then they far off ahead of we. But we safe, we're on the right track. Now you can leave in the house, you call for ambulance. Ambulance they come meet you if there's an emergency. Accident they happen now, somebody listen up, they call for ambulance. Ambulance comes here, paramedics they candy, they take una. They want to go to various facilities. We said they go attend to appropriately. We are talking now about sea ambulance, not so? For attend to people that are in the riverine areas in the. We have in the desire for develop both them with people them a whole hospital on the seas with the solar powered engines and all the what have you. All those things now they in place. So it's a gradual process. Okay. Now also forget see. We get good roads in this country, or get not so good roads in this country. Not so. So access to some places is so challenging, but yes, still names ambulances they go to them places and they bring out patients to where they able to get the appropriate attention when they need. It's happening in this country. You might not be aware of this, but we know of this because we work within the system.
All right, so let me go back to we try for round up now, and we talk about the misuse of them antibiotic and that of drip, and for you, which you don't say this how people in the use not to true. And according to Dr. Ibrahim, talk about say young people, especially women, then they go through them problem there or them profits between the age of 15 to 24 years, and they misuse medicine. In terms of, I know you want for be defensive or protective of your job, you want for talk to medicine really good for X, Y, Z. You prefer them for good seek medical advice and all. But a lot of people are listening to you now, and then believe say them for don't get some amount of education about waiting, then for do or waiting and not for do. In certain situation, but you want for protect, say, want for cities. On here, let them go seek medical attention. What could be done for change this mindset of salon people refusing no for go through medical prescription rather than for go through paper doctor and all.
Okay, we get so many things we need for do. One of such things is like what we do right now, right? Public education. Public education to inform the public about the dangers of what they do, how wrong it is, and why they don't forever continue for do them or even start them. That is one. Two,
Okay.
we need to build a healthcare delivery system that works for everybody. Wherein you go sick, you go get your medical management, your treatment at a cost we affordable, or you use them free at the point of use, but you don't pay for them before you go use them. And this also like system where government they try to implement. It don't work for so many countries, right? So many advanced countries, this is what they have. They call a medical insurance system. Every month you pay some money to insurance. Where you seek attention, insurance pay. So you know before you buy yourself, say, why sick? I'm not getting money for go hospital. We doctor, why sick? They go say I go pay money.
Okay.
Yeah. Then government don't start intensive training of healthcare professionals. If I now say we don't get an exponential increase in number of healthcare professional graduation every year, right? College of Medicine alone, a few days ago, they're hearing about I don't know when around 80 doctors, right? Previously, maybe like 5, 10 they graduate. Now we are chasing 100. So give us the next 10 years, maybe 1,000 will be graduating per year.
Okay.
Right? So once we don't get enough professionals and we're able to retain them within the country, when they work within the healthcare system, most of these problems then will be resolved with time. Yeah?
All right.
But one of the things that people they too much rely on misinformation. For example, if you don't sick, you don't go see doctor, let's say you get an infectious something, right? I don't give you a particular antibiotic at the right time for you. Okay, where you go to pharmacy? Okay, now this one thing, they call the medicine name. You buy them, you go use it, you well. The next day party they get similar symptoms. We be the get. Let's say you just be the itch, right? You private part with the itch, you're the crash. Then you go see doctor. He mark particular medicine for you. You go buy them. Next day party they say Sam, I don't be get crash you. You go say why be sick like this medicine doctor mark for me? Go buy them. Instead go buy them.
Which of course the system is not the same.
That is one. It might be possible that different microorganisms, different bacteria will cause your sickness.
Okay.
It's different from your own. But you will say, go buy them. And he said, because you now go through that process of going to see a doctor, you will say, time consuming.
And then you said, because doctor don't prescribe for you this one, if it happens to you back, instead of you go to medical attention, you
Again?
continue because that doctor probably might be saying a different
That
thing.
different organism.
Okay.
And sometimes even the medicine we go buy ourselves, it could be maybe substandard, it could be the wrong dosage, because we doctor the right most time you read doctor handwriting also, but the pharmacist will read it, right?
They will
Because
clearly
each-
explain how you for take this.
Exactly, right? Sometimes doctor right say take 500 milligram of this, right? And medicine they can make them in grammage. Pharmacy go take say fine. You go take this one, take this two, take this one money, one if you want. But you know, say yes, the grammage, dosage, we doctor don't calculate. Now I don't give you. But you now sometimes we go, give me this medicine. What the pharmacists get now? They said give you, because most of the pharmacists they are business people. They bring the goods from where they sell. That's their livelihood. Now where they sell, they go pay them shop rent. They will feed themselves.
Okay.
So we say give me this, you know, sell and give you.
All right. So
So only for try for control down the first. We are in pharmacists and pharmacies. Pharmacies, right? Therefore begin only sell prescription drugs based on actual prescriptions with doctor did carry it. With doctor did write, we patient they carry to doctors.
all right. Thank you so very much. Continue for the with we report how they go across the streets of Freetown and make we listen to it in then everything and take on the misuse of antibiotic and drip. We'll come back shortly. Stay tuned.
Yes, I don't take antibiotic plenty time from somebody we not to talk to. At one time, I be feed me aid, cold, anybody all be the attacked. So this me auntie take amoxicillin, a cowdovagin, and paracetamol. So at the end of the day, I take am because I no be get money by then, and I be seriously be feel pain. All me be focused on by then na for make am able get well body, because the pain dey wey I dey feel and the aid wey be the heart for make it able come to. At one time, I be sit down, I be dey take medicine. One man be dey pass and tell me, he say, you take this medicine so now with the advice of doctor. I say no. He say, he no say e no good for the health. He say, who knows until you temperature no dey in a normal form, you go take am, it can cause damage to your system. The message wey I get to people dem wey can take antibiotic wey no dey consult doctor or without the advice of doctor na this: when you sick, they need for diagnose you, because perhaps maybe the medicine wey you take, antibiotic wey you take, not to the sickness you dey suffer from. But if you go through the prescription of doctor, they diagnose you and able know the sickness, they go able prescribe the appropriate medicine wey they for do, wey it go beneficial to your health and even to the living standard. Because if you go take medicine wey not to doctor it can tendency at the end of the day it can damage your system, if I can say so. Then also more I want for say government need for ensure say they put measures in place to certain pharmacies them, because at the end of the day some pharmacies that can even sell medicine where it expire, or some people that they student another pharmacies them not so well trained and qualified people the way they in the charge of medicines. At the end of the day, they can just can't sell medicine again, even to the lay people who don't understand. But if they get well trained and qualified people the way they know about medicine, they will able to ensure so they give them the right medicine where it will suit them for the particular sickness where they suffer from.
Yeah, I don't take antibiotic tablets without the advice of a doctor. Like this drug, Ampiclox, because I take it for a specific purpose because of the swelling the parts of my body. So I suggest say that's going more help me for me not swelling. They go away. Why make I take her? Because of that moment the time we don't go. So even doctor self not in the office at that time. According to the advice to the World Health Organization, because they always talk say if you take a drug where a doctor prescribe for you and give a good vital advice.
I know they take her for me, say go and go meet the doctor with me. I know one day buy on the streets, I go drink her for myself. I go meet the nurse. I say that this problem I get, I go to hospital, so me some medicine. I know you take drip. I know one day if you see I take drip now, better I get. I know one day take drip to no more because I get pain already. No, I know one day take damage. For me, I need to go with an essay. Because I take drip for the other thing. No. Me no go for understand for saying that the medicine down the way they put inside injection. Me I know they able to drink medicine so no more. Now inside injection they put in medicine. So me no go for understand saying that this is put. Me no go.
All right, thank you very much to the team for put that one day together. Let's spend probably 2 to 3 minutes, and the concern from you and salon people I mean, walk into a pharmacy without prescription, and then pharmacists then they sell medicine and give people them, and which of course you therefore look at the kind of medicine pharmacy board of recent we see the work when they do for shut down or fine most of them pharmacy, then they will not get pharmacists, and also they carry drugs there where they're not supposed to come into the country. But I mean, it's difficult when you go to a pharmacy. You see people go with prescription and say, I want that. People they go, sell give me, and I will call pharmacy they don't go. What, sell give me X, sell me Y. And those pharmacists they even ask them, say, well, is it you get prescription or not? This is a challenge.
Yeah, you see, that is true. And even people themselves way in the street, some of them understand this challenge. Because I hear person talk, see, most of the people they work at the pharmacy, they know to be pharmacist. So they are aware of this.
But yet still they are there.
Well,
so
they are there.
So they don't have case for pharmacy board for handle.
Yes, they are there. Maybe they are your salesperson, right? But each pharmacy for the man, at least if you get a pharmacist and a pharmacy technician on duty at any point in time. Yeah, then anybody can do it for sale. But if patient come with prescription, the pharmacist for see him because I know within that doctor they don't write. I know able to read them.
So how we will change this mindset? Because again for do it, una pharmacy board set for kind to this. I mean medical doctors and set for kind to this. As I say, you go to any pharmacy now, out of 10 posts to go by that particular moment is an actual prescription.
That is true. That is true. Not only work with pharmacy board and doctors and need for do, it's the entire country. Everybody has to be involved. First and foremost, you say we buy medicine for yourself. No sin harm you do to yourself. So when you sick, first go see doctor. Doctor prescribe medicine for you. Then you go buy them. That is one. Secondly, even the pharmacies themselves, when they sell them medications in they need for stop. For the renting in the. If you know see this medicine, possible for only use them based on prescription. If possible not called prescription, not sell again. Other countries, that's what they do. Prescription drugs is labeled and it can be tracked. Wherein, if I go buy X medicine, let's say in a Y pharmacy, right? It can be traced that on this day, on the 3rd of December 2025, Dr. Tarawally bought this medicine in Y pharmacy. It can be tracked. They don't create a whole digital system where they track everybody on such platforms in the. So we as a country need for sit down together with Ministry of Health, Ministry of the other healthcare agencies around health business, the Directorate of Innovation and Technology. We use Ministry of Communication and Information, whatever, for really create a system. We can use technology now; it's easier. We can create an app wherein we go link the doctors, the hospitals, the pharmacies, and the patients. Wherein, if patient go hospital, you prescribe for them. In prescription, they go straight to the pharmacy. Say go na social pharmacy, you medicine did. When the prescription go to the pharmacist go look at them and prepare medicine, they go take them. I believe see this health also government they try for create they look at all the problems and they get for solve eventually.
Quickly before we round up, wait like the duty of a pharmacist, because why are they asking this? You go to pharmacy now. Myself don't be. Most time I can go pharmacy not because I want to go buy drugs, but I want to see waiting they happen. They will ask you, I want this medicine. First question they ask you, waiting do you? Well, are they filling me A, the X, Y, Z, and they are done with you. Then pull the medicine you asked for. I mean, so that begs the question: waiting are the duty of a pharmacist? Quickly, let's spend 1 minute on that.
Wow. Yeah, you asked me a very tough question. Me not a pharmacist. I know. Let me colleagues in the pharmacy profession come run after me. But what do you know about a pharmacist? This is a very aristocratic profession, right? These are professionals we then train in the dispensation, in the use, management, development, sale of medicinal products, and its regulations. Now that we know.
So pharmacists are able to treat person?
Yes.
Okay.
They can treat you at certain levels.
Okay. So now we pass certain level, you find you say, okay, go hospital and all anything in there.
Yes.
Okay, so that means there at some point we are right where some people can go pharmacy without prescription because pharmacists they for
see them
for pay attention.
There's healthcare professional there. There's pharmacists there. If pharmacists did it, we exactly know what for do. Fine, he will see you, attend to you, and in some of those cases, people in the world from that. There are some point we all seek such help somehow. It was through the professional person we did that pharmacy.
How frequently person for go for a medical checkup? Is it on a monthly basis? Weekly? How should we?
Well, me go advise if na every month you go for a checkup. Doctor see you, assess you, you run some tests. It go much better. But now every quarterly, yeah.
Okay.
But this may the one who you not pass, you know check, you know the medical checkup is not good. Because sickness not start one thing. It starts gradually. So by the time the symptoms they appear, you will begin feel sick. It don't take a very long time. Okay. But in that initial stage, they see easy for manage.
All right, thank you so very much, Dr. Augustine A.D. Tarawally, and for your time for being part of the Epic Morning Show. We get to first call online, logo online, and pick this call. Hello, good morning. Hello, good morning.
Yeah, good morning.
Good morning. Your name and where you call from, please?
Mohammed, I call from Cambia.
All right, Mohammed from Cambia. Go ahead. How did Cambia this morning?
Yeah, which I want to say concerning this conversation, we get a problem, and that problem they be.
Okay.
For example, when you go on buses, you see people then they all megaphone, then they sell medicines. When you go to their marketplaces, you see stalls spread with medicines. People then they sell the one, then the pharmacists then they do well, then they try, but then they still get challenges with them people here so, and we not they see anything they happen. You go na Poda, you go na buses, they call themselves marketers, they sell their medicines there, and people then they buy them. And if you don't listen, they're so sabi talk, and we they call. I mean, Sunday even they talk like a professionals, and they tell you. So I mean, now in one problem, the pharmacists them again, they're not they get job like how the doctors then they get. Doctors then go come out, then they employ them immediately, then do housemanship, then they get that job then to government. You see, so I mean, we need to do something about this one, especially the one where they talk so within a buses with megaphone, poda, and then the marketplaces and spread and stores all the thing and they.
All right.
Thank you.
Thank you so very much for my number. And 079-994-993, the use of the misuse of antibiotics and that of grip, how people they use them and take them. Hello, good morning. Your name and where you call from, please. We seem to get issue with our line there. We do call, make sure so you're in a one kind quiet environment, and also stay away from your radio and stay within 1 minute and what you want to talk about. Logo online. Hello, good morning.
Yeah, good morning, Brian.
Evangelously.
Sorry, Ivan. Good morning, Ivan.
Good morning, boss.
Yes, and I'm Taf from Central.
Go ahead, man.
Thanks very much for the wonderful program. I want to say thank you to the guests. When we count and can't guess here, I let you fool. You will understand. Because explanation is so comprehensive. I let you fool, brah. You will understand. But I want to say thank you. Let go the cow then can't once in a while. But this to both says this may last brother in this last quarter. Believe me, brother, not to lie. Them government pharmacy board when they go not to the market two man in a tweet. Why when they go not to them the marketers and them boss them? Because at the sooner when they arrest, when they go not to tweet, yes. Why when they go not to the one in them bosses? That's what yesterday. All day go see them for the old megaphone guy. That big set line is now. Put on them junction. Some of the boy, you don't even know what they give for buy. This stuff for that. You go give a lot mercy, say that for that. They go give punch mercy, say that for Belat. Can you imagine how they kill people slowly? So the pharmacy them they try because mostly like we will go understanding. Where you go, you give prescription, they read them, they say that so. Or we go, they ask the consent, explain them to the pharmacist. Say, pa, the soldiers try to feel it advice. Unlike the other one, they will not get that, they will not fail with the issues here. But pa, I want to thank you now with the cow the people here. Health business, people in die of wrong medication.
Thank you. Thank you so very much. 079-994-993. Now the number for be part of the Epic Morning Show. I think okay, we'll go online again. We'll get another call online. Hello, good morning.
Good morning, sir.
Morning, come on here, you radio set to the get
the power which you don't
okay, go ahead.
Try for very like you but putting there. Now one thing I want to try for this is of way talk about we possibly go give money for every month for Medicare. It's not all the hospitals, government hospitals in the world.
All right, so we'll talk about. I think that not the health society talk about. That's government we talk about. The Ministry of Health we talk about on this some months back. Well, whether it don't start or not, well, it's something we'll get them for talk about on there. How that's there for work. Log online again. Hello, good morning.
Yeah, good morning, Epic Radio.
Good morning.
Thank you so much for hosting.
All right.
Doctor this morning, of course. these now critical issues and it really don't disturb health issues in the country. The intake of either drip or antibiotics so much. On several occasions, you see them with tired and you probably take them and say, after I don't mess like this, as opposed to it. The other thing is wrong. So, it don't already don't need that, like your brother has said, there has to be continuous public sensitization on this. You know, again, it really is so much unfortunate that we get body with the able for regulate even the face or the control of them pharmacies. Now it don't happen to say now pharmacy now one area where people they generate money. So a lot of pharmacies in the country must get unqualified people who not even have been nothing but medicine. How far pharmacy body regulates them? You go out there with the see they get people that always get them bag, they always get them box, and they send medicine. Now these people are doing at their remote side. It's really unfortunate, but like we always say, salon business, we are need to make a change the attitude. We dey follow the principle and the rules. All will be well for you. Thank you so much.
Thank you so very much, Coca from Bo. 079 994 993. Now the number for be part of the Epic Morning Show. And of course, they talk about the misuse of antibiotics and that of drip and how people they take them plenty without medical prescription. Hello, good morning.
Yes, sir. This is not the Lion.
The Lion, good morning. Go ahead.
Yes, sir. You know, Palek, God help you.
Amen.
You see the pharmacies, them, they get doctors, them. When you go there, they get doctors, them. And me, waiting me, they see, like, repair where they analyze so, you know, you need to talk for let somebody go be happy for let not say it. These drugs, is harmful, let not take them. You know, you need to talk to go the tea, you they talk no more there. Because when you as a doctor, when you come inside, like, when you know, they platform there, so. Tell me, say, if I take tramadol, now now the harm this. Who I take this medicine, so I take that in a day. When I this, now you know, if they affect, when they affect you, where it go, you know, when they watch them place, they stand at their hotel, when the doctors, they stand at the media, I swear to God, when they talk, if you bland who has a finish the work, boy, I will not get doctors in this country.
Thank you.
I like why 6-0, why 6-0, bro? If come on, I go now, before they go now, the best hospital I go see, where possible, sick go. You know now up 34 is the best.
Thank you.
I don't go sick now say like gonna come out because I go feel say something I go now the worst I will get. You not so well.
Thank you so. Thank you so very much. 079 994 993. Now the number for be part of the Epic Morning Show and the local line again and pick another call. Hello, good morning.
Hello, good morning, Ivan.
Good morning.
How the morning? Now, per content talk from Upgon.
It's per content from Upgon. Good morning. The morning of us.
You see, the doctor, he analyze, he talk fine. But what's in the problem? Then we villages, then suburb. Who said, we not get doctor, we not get this. Some man, they go with some medicine, then they go sell give with people, and sometimes, not so the correct medicine, they go sell. You see, we better, we all in a tongue, at least, if you want something, if a doctor writes for you, you go na pharmacy, you DM, because me, before I go na pharmacy, pass I go to me doctor, he tell me, say, go buy social medicine, give me prescription. But they were in the villages, they were in the suburb. Yeah, let government try for look. Thank you very much.
Thank you very much, Paconte. It's another concern. How many people will get private doctor? I mean, we know the medical history and all. That's another challenge again. But anyways, log online again. Hello, good morning.
Yeah, good morning. This is Bakar from Fomex.
Bakar from Fomex. Go ahead, brother.
God bless you.
Amen.
The journalist, you understand? We doctor they analyze. I get so many issues in this. One, the doctors they will Abupa. When you go to hospital, follow them doctors and they go check you. The doctors they get style. And they go get people that will be special with the doctor not do. At that moment we like the field. They let the doctors then so make themselves so important that then they make that way Now the patients and they run after them, then they struggle for access to the doctors there.
Yeah.
That because if you go na Motuka, you go hear somebody, he will explain about treatment then when you settle the feel. If you feel medicine as human, you understand it. They make some man buy the medicine. Come again to the pharmacist then. You want to really deal with pharmacies. My brother, I dey tell you, I want me to check all the medicine they already can salon. If the medicine they need real or if you need to talk. Even when you go to hospital, then they give plenty medicine. At the end of the day, the body system not the well. The body system not the well. Take like I get one brother with America. When one day he explained to me, say, they sick. When you go now 1 grain tablet, 1 grain tablet, 9 gram. They no need for go put drip on you. They no need for go do injection. And only 1 tablet in jam. They say you okay. Try to pain the way pull a salonia. Talk about that and all. They say 1 grain medicine, 1 grain tablet, 9 gram. Salon we get sent. Well, that's why the people already check some of the medicine they really can salon. Our doctors and then they actively for them to take care of the life of we. Let me check them here before they begin seeing their place. Before they hunt people and they take and say they're not going to do this, they're not going to do this. How will they present them here? Thank you.
Thank you so very much. We'll try for talk to the Minister of Health because there is so much issue. And when you go safe now the hospital and some of them the pharmacy degree within the hospital very much expensive past the one in safe within at least where they outside of the hospital. So it's another concern. Hello, good morning. Hello, good morning.
Pamusa, the corner back.
Hi, Pamusa. Go ahead. We'll ask caller. Yeah? Go ahead.
Okay, what are the try for talking this for? Because some people in the free for going to the hospital there. Now the test is difficult. See, the test difficult. At times somebody gets small money. We go before they don't pass passport to God. Then 2, 3, 400,000 not done. We do not give 1 tablet safe. So now the reason this way people in the sick, then they find the community nurse or community doctor. So now the reason they know the doctor really talk fine. But if they make a reasonable, okay, like example like testing, okay, let me show now. I get problem so with the money in my body. Then I go now for life doctor go test me. For the doctor for to go na money, for test na money. So now the reason they know who is people when they run behind doctor. Now talk about the upline. There's some place and they buy not the go the most cannot go there. You see, so how long they commodity? Let me this street one come out to Magburka, Tongolele district. For Komona Mizile, take I some Magburka town. And the low check for buy Komotuka. So now the reason the never Dr. Tenki really enlighten you this morning and God bless you.
Thank you so very much. We're not going to pick any more call again. Doc, I think once I agree with you, if X don't go hospital, that prescription it can serve over hundreds of people. I mean, but another challenge here. People they go to the government hospital and they most often are doctor and get to a private hospital. If we it's just like education, we teachers private schools and government school we teachers they pay more attention to the private hospital because they think they more money there, and that's of course it happen in the medical sector. And also, I mean, when you talk about US, that's bringing me to where we talk about one for compare accessibility. US they based on an appointment. I mean, they get, I know small about America where people go tell you, say, I get appointment to doctor. I mean, Sierra Leone, it's happening, but at some point, it's difficult. But in terms of them believing emergency response, very much timely. If you get something, you get attacked. I mean, it's fast for me to respond. So, in as much as we don't want to compare them to Salone, we are trying as a nation where you can respond to the calls then quickly.
Okay. First, you talk about appointment in US. In Sierra Leone, you can walk, I don't tell you, say you can walk from here to Connaught Hospital, doctor see you. Right? In US,
but most of them doctors, they said, get in private hospital where difficult to see, and people can attest to the fact that.
Well, not most. Some of the doctors, where they
no, I don't say all, but it can happen.
Some they get private practice.
Yes,
that
but
is true.
The point I'm making,
there is
it
nothing
happen.
stopping any doctor from establish a private practice.
But it's about paying attention to the private and that of the government hospitals there.
The government hospital, the advantage we get compared to a private hospital, in the government hospital, mostly there is a collective multidisciplinary team where they look at every patient from every angle. Yeah? Patient, if you go no more with your sickness, but not to you, that you fever, we can't go no more, will be your problem. Yeah?
Okay.
You can get nutritional problem. You can get psychosocial problem. Not so. You can get spiritual problem. Not so. You can get surgical problem.
Okay.
We don't need cause for that. We don't need to that fever. So a group of doctors from different specialties, right? Not only doctors, even other healthcare professionals, psychosocial workers, then they within government hospitals when they go manage you effectively.
All right,
in
continue.
a private hospital, so until you go in a one doctor they see you, and the waiting time is very short in a private hospital than the public hospital because of waiting patient overload. More patients go to government hospital because it's cheaper than private hospital, and government hospital for we the poor people there. And we poor na oboku na salon.
All right.
Then we not get enough manpower shortage. We not get enough manpower for attend to every patient in time. Hospitals are understaffed.
All right.
Right? We get doctor to patient ratio in this country. The entire country, they boast of, the last time I checked SLMD directory, we are around 500 doctors to a population of 10 million, roughly around 10 million.
8.5 million.
8.5 million. Well, look at that disparity.
They get 500 doctors.
Yes.
Across the country.
Across the country.
Well, okay. Respond to the message then quickly.
Right.
Okay.
So this is what we call from Cambia. We talk about the marketers. That is a very serious problem in this country, and we need to address them aggressively. Me go advise anybody not buy medicine from the marketers indeed, because if person they buy the medicine, they will stop for sale. That is one. And most of the medicine they sell is substandard, not to the actual medication. So it's not fake medicine. They just confuse people then with the sabi talking and lie. It's absolutely lie. Most of the people they talk them when bosses indeed, them to carry indeed, na lie talk. I remember at one time I be travel from Kenya to Freetown. At my shaka, person claim the boss begin tell you about medicine and how the medicine the main hernia. And I ask her, is about a hernia? You know talk. So why they say medicine we see the main hernia? So that moment the arrest all in bag. I found this because of abusive substance inside it. We push her off the bus. I said, "May go report to the police." So when I not buy the medicine, they send to the marketers in the street. Then when they put them BB loudspeaker, they announce all kind of medicine. They mean all kinds. One medicine they mean past 5, 6, 7, 10 sickness. Not buy them. If possible, I can do citizens arrest. The law provide for that here because this is becoming a national security threat. Anything they threaten the existence of a nation, not to one man business, not to government business no more. Now the citizens their own business, now the citizens, because if the country collapse, now we they suffer. As a result, anybody when they inside bus, when they pass on the street or whatever, they come with you fake medicine or this medicine it mean XYZ sickness. We know to pharmacist, you know, sabi nothing with medicine business. You're not supposed to sell that medicine there. When I can arrest and hand over to the police. No responsibility then as a citizen. So stop buying these medications from these people. They are just exploiting money from you. They get the thief of money, literally. Yeah. Then this Mr. Man, we talk about this medical osusu, this health insurance. I know government not officially launched it, but there is the process is ongoing for create this health insurance system. And I believe by the time when they don't for create them, it will be across all government hospitals.
Yeah.
Yeah. I mean, if you're a member of that osusu system, when you sick, you can go hospital. Doctor can see you. They can do you test them and prescribe medicine for you. We will get.
Okay.
Yeah. That one is ongoing. This Mr. Kuka from Bo. With now talk about this tramadol misuse, right? Tramadol. As they say, me no can condemn tramadol. Me no can condemn this medicine. Say bad, it good. I'm not talking from first. The first ever kind of begin talk. I tell you, say all medicine good, it bad. Depending on how you use and the dosage.
No, but immediately for say at least you forbid all states the side effects.
Tramadol.
Listen to me. Just get example. You not talk about tramadol, but you get example like most of because actually about ampiclox, amoxicillin, and those kind.
I make it clear to you. Say all medicine get adverse effect. Any medication gets good and bad effect.
Okay.
Yeah. And each medicine they work in different people then differently. Maybe you get a headache. Let's say for example, okay, you get malaria, I get malaria, right? In fact, me and between border, we'll be young. I remember quite be sick fast. Then there was a time we were sick, me too. Then came to hospital. Then that time quinine was the drug of choice. We did use in a salon for malaria. When they inject some quinine is okay. When they inject me with quinine, my body they crash for 3, 4, 5 days.
So you don't fit here.
You understand? Well, these are the same people, me too, the same papa, they born the same day, the same time.
Okay.
You understand? So each medicine, each person, they work differently. So that is why I advise you, not just use medicine for yourself. Go first, make the doctor see you, because before they prescribe medicine for you, I have to ask you a whole lot of questions. Yeah? I have to ask you about your allergic history. Any medicine that we don't take, we don't get bad effect on you. You go say, yeah, today I take paracetamol, my head hit the tongue. They are not say this man in paracetamol to party. So may I get other medicine where they get the same effect as paracetamol, but with this, we don't get the side effect.
Thank you.
Yeah?
All right.
So likewise, this tramadol, this man mentioned, tramadol is prescription medication and makes the doctor to use in the hospital. Yeah? So I know we can't talk say tramadol is bad, no use them. No. But go to doctor, a doctor see there is a need for make you use tramadol, the right time for you, the dosage you for take, and how long you for take. Beyond that point, no take.
All right. Okay, thank you so very much, Doc, for your time for being part of the Epic Morning Show. And quick takeaway message is like, go hospital, go for medical checkup. Not use one person in prescription because of this person take this medicine for this particular sickness. It help them. That means Yusuf, it will help you. And as I say, one thing I take away that they affect so much people in this country. One prescription can serve almost thousands of people, because when this person, it fits this person, that person tell me I be take this now, this fits me, that person, I show the message they go cut across. That because I take ampiclox, able men infection or cure infection, that means your infection it will be cured. But the advice here is best thing now for seek a medical advice or medical attention or doctor prescription. Thank you so very much, Doctor, for your time for being part of the Epic Morning Show.